Good afternoon, everyone. This is Adrienne Bush with the Homeless and Housing Coalition of Kentucky. And welcome to the September COVID-19 state and federal policy updates. We're happy to have you with us today. This webinar is going to be a little bit different. We'll be covering some policy updates, but then we are featuring a spotlight on housing and homeless assistance with Kentucky Housing Corporations. We're really excited to have them on board. While we are waiting for people to join, we'll go ahead and start moving through the slides. So if you want to go ahead and do that, Kelly. Just as a reminder, for many of you who join these monthly webinars, you know that the Thrive Kentucky campaign advocates for a strong and equitable safety net. And therefore, we cover all sorts of policies, whether it is healthcare or food, nutrition assistance, housing-related policies. We want to use a welcome mat approach, making public assistance as accessible as possible for Kentuckians in need, and meeting them with respect and dignity and without stigma or judgment. I want to drop down to the fourth bullet point. Just make sure that we are highlighting that we prioritize racial and ethnic and geographic equity among Kentuckians who face historical and systemic barriers to meeting basic needs. Next slide. You can see our steering committee members, all of which participate in the campaign and the coalition's work. And next slide. And thank you to the sponsors who make this work possible, Aetna, Humana, and United Healthcare. Next slide. So the agenda today, guess what? We're in a special session. We thought that the legislative session was over. It is not. Kentucky General Assembly is back in Frankfort. So we are going to start with an update from Dr. Sheila Schuster, kind of getting us acclimated to what is happening at the Capitol. Move on to SNAP changes and community eligibility program application for schools, COBRA end of premium assistance, insurance coverage for COVID-19 testing, and then the bulk of the meeting today will be talking about Kentucky Housing Corporation and the programs that they offer, particularly with the COVID relief packages that have been passed by Congress, including the American Rescue Plan Act. And then we'll wrap up with resources for advocates and consumers and questions and answers. And in the meantime, if you do have questions, please, you can keep yourselves on mute. In fact, please do that, but feel free to post questions in the chat and we will get to them as we move through the presentation. Next slide. All right, and with that, I'll hand it over to Dr. Schuster for our 2021 Kentucky General Assembly Special Session Update.
Thank you very much, Adrienne, and hello to all of you. When we planned this webinar, we did not know that we would be in what they call a special session or an extraordinary session, and it is indeed extraordinary. So I'm Sheila Schuster. I'm a licensed psychologist and executive director of Advocacy Action Network. So the special session began at 10 a.m. this morning with the House coming into session. And we're not sure exactly how long it will be, but probably 3 to 4 to 5 days. So it may run into Saturday of this weekend. Just to backtrack for a bit, the Kentucky Supreme Court ruled on August 21st that the Franklin Circuit Court, which had injuncted or put a stay on implementing House Bill 1, Senate Bill 1, and Senate Bill 2 from the 2021 General Assembly, were not to be put into action. And when the Supreme Court ruled against that, they sent the case back to Franklin Circuit Court to dissolve the injunctions. I always think of dropping a pellet into the water and dissolving them, but I think it's not that easy. So just to remind you, House Bill 1 passed by the 2021 General Assembly suspends the governor's COVID-19 emergency executive orders. It forces nursing homes to admit all visitors, would end some telehealth flexibilities, voids home health services ordered by advanced practice registered nurses and physician assistants, and allows utilities to end payment plans and reinstate late fees. Senate Bill 1 limits all emergency orders that restrict in-person activities to just 30 days. Senate Bill 2 defines an emergency and requires agencies to put on demonstrable proof that there is an emergency. And then when these were overridden by the General Assembly and the governor appealed to the Franklin Circuit Court and an injunction was put into place, the General Assembly, while still in session in 2021 in regular session, passed House Joint Resolution 77, which allowed all of these bills to limited the emergency orders to 90 days. Next slide, please, Kelly. So these are the issues that the governor has laid out, and he's put in a plea. You've heard him on all kinds of media and in the newspaper and on TV and radio. He wants the COVID-19 state of emergency extended until January 15th. Remember that the General Assembly will be back in regular session on January 4th of 2021. So they're giving themselves about 10 working days there to get back in session and get going. He wants all of the emergency orders that were issued by the cabinets and the agencies and the licensure boards to stay in effect until January of 2022. And these are important suspensions of existing. For instance, it allows nurses to come in from other states and go to work here in Kentucky. It allows psychologists such as myself to come across state lines and provide needed services without going through the usual rigmarole to get sanctioned by the Board of Psychology and so forth. He wants them to set out criteria under which he could require facial coverings, and that's probably the most controversial of all of these items. The mask mandate has really been the one that's gotten the most outrage in the communities. We also know that they passed House Bill 208 in the last session, which limited the school districts to only 10 NTI or non-traditional instructional days. And you see that school districts are already closing down, and some of them are not wanting to use up those precious few 10 days. So they're just closing down and letting people go home and take vacation days until they figure out what to do. But it would allow for some flexibility in that, additional sick days and some funding stability. Funding in the school districts is dependent on enrollment, not enrollment, but attendance. So if students can't come to school or you don't have in-person school, there's got to be a better way of getting your funding. And the governor would also like to allow retired and student teachers to be able to be authorized to provide instructions during the school day. He wants to appropriate up to $69 million from the American Rescue Plan funds for COVID-19 mitigation and related expenses. So that's testing and contact tracing, the PPE and communications. And then he has two things that are really not COVID related: appropriate $2 billion for economic development and extend a state of emergency for 30 days to address flooding in Nicholas County. So Kelly, the next one, please. So if we didn't have a special session, or if they don't take appropriate action, all of those emergency executive orders would end after 30 days. Also, the moratoriums on evictions and on utility shutoffs, which would affect hundreds of thousands of Kentuckians, would also limit the cabinets, that's the Cabinet for Health and Family Services, regulatory power to address contagious and infectious diseases, and limit that to only 30 days. And the way those bills that were passed by the legislature are worded, you can't just change a single word and come back with a new executive order. It can't be about the same subject matter even. It would force nursing homes to allow visitors despite the pandemic numbers. It would end this reciprocity that I mentioned earlier for some of the healthcare professions and reducing licensure requirements to expand workforce capacity. And it would restore the pre-pandemic visitation conditions for kids with non-custodial parental and fictive kinship. And some of that has been suspended because of the COVID restrictions. So all of that would go back into pre-pandemic modalities without action by the special session. Next. So the session is likely to last 4 or 5 days. It costs approximately $68,000 a day. I can remember the days when it used to cost about $35,000 a day. So way back when. So they want to get in and out without unnecessary delays. If you follow the action, there will be committee meetings of the House and the Senate, of state and local government, of education, of health and welfare, or health and family services, and possibly appropriations and revenue. You can attend. The Capitol Annex is open. You need to go through the visitors entrance, which is up at the first floor, right across from the Capitol, and show a picture ID. So the basement and first floor of the Capitol Annex are open to visitors. You cannot go up on the second, third, or fourth floors where the lawmakers' offices are located without an appointment. And we have no guidance as yet about access to the House and Senate galleries over in the Capitol building. So I can't help you out there. All of the committee meetings and the meetings of the chambers, the House and the Senate, are being live streamed through the KET channel right now, or with the Legislative Research Commission YouTube channel. So you can follow the action. And the last slide, please, Kelly. So as you do in the regular session, check the legislative website at www.legislature.ky.gov to get the meeting materials. I don't think the bills were pre-filed, so they're not up on the website yet. I'm sure they will be posted by this evening. And again, you can watch the meetings of the committees and so forth. The message line, the legislative message line, 1-800-372-7181 is open, and you can call and leave a message for your legislator or for a whole committee of legislators. And you can also try to reach them by dialing their office number, which is 502-564-8100. If you are a constituent and you're trying to reach your senator or representative, be sure to let the receptionist who answers the call know that you're a constituent. Constituents go to the top of the pile in terms of attention from the legislator. So I will stop at this point. Oh, again, emails, and you know that email address, firstname.lastname@lrc.ky.gov. If you have any questions, please put them in the chat. We will try to send out regular alerts to let you know what legislation is being considered. And with that, I will turn it over to Jessica Klein from the Kentucky Center to talk about SNAP and CEP applications. Jessica?
Thank you, Sheila. Hi, I'm Jessica Klein with the Kentucky Center for Economic Policy. I'll be talking about our food and nutrition programs, SNAP, a quick pandemic EBT update, and then CEP applications for schools. Next slide. So this is a graph of SNAP participation in Kentucky. You can also find it on kypolicy.org website. Currently, we have updated data through July, and about 13% of Kentuckians participate in SNAP, bringing $133.3 million to the state, and ensuring that all of those families, which is about over 582,000 Kentuckians, receive the food assistance that they need through the SNAP program. Next slide. A couple of updates related to that program. Emergency SNAP benefits. So we've also called this emergency allotment or max allotment, even EA is another abbreviation. This ensures that every Kentuckian on SNAP is able to get the maximum amount for their household size rather than being based on income. And this has been approved since April and is now approved for September. Those benefits should have gone out last week or this week for September, so people can expect those coming soon. But to Sheila's point, it is contingent on our state of emergency. So that's something that will be discussed during session currently. With that, also the 15% increase that we've seen throughout the pandemic, that is a 15% increase in SNAP benefits for everyone in September 30th. Luckily, this is happening the same time that the Thrifty Food Plan is modernized, and that's the plan at the federal level that calculates SNAP benefits for households. So that's going to be a permanent change, and that starts October 1st. And what we're likely going to see is an increase of about 20% per household based on pre-pandemic benefit amounts. So 15% ending, but this other increase is coming, so it kind of evens out. I also want to remind everybody not to lose benefits by forgetting to recertify. Recertifications took a break during the pandemic, but began again April 1st. So people can expect to see a notice with the recertification date and maybe a list of documents that you might have to provide. There is some flexibility with that in terms of you can mail it, you can fax it, you can share it on Connect, or you can also call the 855 number to talk to somebody about your case and what you need to do to recertify. A little bit of confusion's been out there about what counts against you in terms of recertifying. Things like stimulus payments, some of the UI payments, and the child tax credits do not disqualify you. So if you aren't sure what all affects your qualification, you can call that number again and double check your case. Next slide. A couple of updates around pandemic EBT or PEBT. We saw the child care pandemic EBT, which is for kids under 6 that participate in SNAP and lived in a school district that was closed at some point between October 2020 and May 2021. Went out, I think it was like a 2-week basis over the past few weeks. That's now concluded, along with the summer EBT program, which provided $375 per student who previously participated in pandemic EBT because their school participates in the National School Lunch Program, and they were either virtual or hybrid last school year. So all of that's gone out at this point. You can check the balance on your card by calling this 888 number. You can also, if you didn't receive these benefits but think that your child is eligible, you can call DCBS and talk to them a little bit about your eligibility. Next slide. Finally, I want to talk about something we haven't mentioned on these webinars before, which is the community eligibility provision, CEP for short. So CEP is a program within the National School Lunch Program. And what it does is it provides every student in a school with free meals, that's breakfast and lunch, based on the % of students in their area that's eligible for the program. So if more than 40% of students are eligible, then everybody in the school can just have blanket access to the National School Lunch Program. And what that means is it reduces administrative burden of having to do applications for every student. Instead, it's just administered across the school to every student. It also eliminates any unpaid meal debt because every student is receiving free meals. So a little bit of confusion going around about this is that every school, public school, is providing free school meals this year, whether they participate in this or not. But it's important for schools that are eligible to still apply. So we're just sharing the application date is September 30th. There's also a map here where individuals can look up their school to see if their school district is already participating. And if not, they can encourage their local school board or school district superintendent to apply for the CEP program. And again, this is important not only to identify those schools so that they can continue to participate in CEP moving forward. so that every student receives free school meals. But also it depends on eligibility for the pandemic EBT program, because individual students are eligible for that program based on whether they participate in the National School Lunch Program. So just wanted to uplift this upcoming application so you can check to see if your school is eligible. And with that, I'll turn it over to Priscilla. Thanks.
Hi, everyone. I'm Priscilla Easterling with Kentucky Voices for Health. I'll be doing 2 quick updates on COBRA and COVID-19 testing. So next slide, please. So one of the major health provisions under the American Rescue Plan was a special provision that allowed for 100% COBRA premium subsidies for eligible employees. So from the period from April 1st through the end of September, which is this month, there was 100% premium assistance for COBRA. So if you were enrolled in COBRA from during that time, April to September, your employer would actually be covering 100% of that premium payment. Unfortunately, that is coming to an end at the end of this month. So you have this last month as a chance to enroll in COBRA and get that premium assistance if you have not already. But when that assistance ends at the end of this month, you are eligible for a special enrollment period through the marketplace. So as soon as that subsidy ends at the end of this month, you can go through, or in anticipation of this subsidy ending at the end of the month, you can go ahead and go through healthcare.gov and shop for plans to access this special enrollment period, and shop for plans with that with those increased subsidies already included, and find something that could cover you for the rest of the year. If you have any questions about COBRA, you can definitely, I link to a frequently asked questions here. And also we've heard some various stories of people not having those COBRA premium payments paid out or having trouble accessing that. If you are one of those people, if you know someone who has had any trouble with that, please reach out to me directly. My email is attached, Priscilla@KY Voices. Just please email me. We're trying to gather some more information about that and would be happy to sort of help anyone who's having that issue. So next slide, please, go. So insurance coverage for COVID-19 testing. So things have changed a bit in the last year. COVID testing is still very important. Next slide, please. And it's still widely available. However, a lot of insurance companies have moved over to only covering COVID-19 tests that are deemed medically necessary. So medically necessary tests are the only tests that sort of fall into that category are: 1, if you've been experiencing symptoms; 2, if you've been exposed to someone who had COVID-19, who has COVID-19, and that's why you're seeking a test; or if you go to your doctor's office or a medical facility, a lab, and they refer you for that test. So if you go to a doctor's office and they take the test, then if they administer that test right then, all of that is deemed medically necessary, and your insurance company should be covering it. If your insurer is fighting you about that, or if you're having any problems with that, you can always file a complaint with the Department of Insurance, which I linked here. And what we've sort of generally heard is if you sort of push back a little bit, most of the insurance companies will sort of go ahead and let that bill go because they know that they should be covering it. But because sort of this weirdness is happening right now, there are also some pre-testing sites that are available, and the state is currently putting together a map that'll be available on the Team Kentucky website, which I have also linked here. Next slide, please. So a couple of the things that the state is also doing to sort of help out, to help clarify this testing issue. So the Kentucky Department of Insurance issued guidance to insurers, letting them know, encouraging them to waive all cost sharing for COVID testing. That includes copays, co-insurance, deductibles, anything that would be out of pocket for you. And then to also waive any medical management requirements like prior authorization, regardless of network participation. The DOI guidance basically said, insurers, COVID-19 it's still a pandemic, it's still a thing. Please waive all of this. Please let it be as free as possible. So again, if you have any issues with your insurer covering that, you can always file a complaint with the DOI, and they can help follow up with that. And then for Medicaid specifically, CMS, the Centers for Medicaid and Medicare Services, issued guidance last week to all state officials across the US, reminding them that the American Rescue Plan requires Medicaid and Children's Health Insurance Program, or KCHIP in Kentucky, to cover COVID-19 testing without any cost sharing, period. That began March 11th, and it goes beyond the end of the public health emergency, at least a year beyond the end of the public health emergency. So if you're on Medicaid, you should never be paying anything out of pocket for your COVID-19 testing. And if you're insured otherwise, make sure it's medically necessary. If you can find a free testing site, definitely do that. And otherwise, you can always file a complaint with the Department of Insurance. And if you have any questions about any of that, reach out to us and we'd be happy to help walk you through that. And I think that's it. So I will turn it over to Adrian.
All right, well, internet issues and spectrum outages notwithstanding, I believe we have Wendy Smith, who is the Deputy Executive Director at Kentucky Housing Corporation, who is going to talk to us a little bit about what is a Kentucky Housing Corporation, as well as some of the programs that they are operating in the time of COVID. So with that, I'll turn it over to you, Wendy, if you're able to talk.
Hopefully I am. You can hear me okay and I'm not too glitchy. My apologies. I had to restart a couple times, but
you're good.
it appears to be working right now. Yeah. Well, thanks, Adrian, and thank you all for having me. For some of you, this is maybe a slight repeat with a little bit of different information, but I work for Kentucky Housing Corporation, which is a statewide organization. We are a quasi-governmental housing finance agency and are the administrator of multiple housing-related COVID-19 federal relief programs. And so I'm going to tell you all just a little bit about KHC, but then we'll do deep dive into the housing-related COVID relief funds that we're overseeing. So if you'll go to the next slide, that'd be great. So Kentucky Housing Corporation, our mission is to invest in affordable housing solutions for families and communities across Kentucky. And much like the work you all do, where you're seeing the intersection of, health and poverty, or health and housing, we know that good quality, affordable housing can make all the difference for a family and for a community. If they're going to be just sustainable and stable, let alone thrive, they've got to have affordable and quality housing. We are a state housing finance agency. Every state has one. We have some special powers around bonds and tax credits related to that. But each state's entity does a slightly different profile of programs and activities. We are self-supporting. That means we are not part of the state budget every year. Our staff are not state employees. I'm not a state employee, but we do answer to the finance cabinet and the governor's office. And so in that way, we are quasi-governmental. I like to say we're a little bit like a bank, a little bit like a nonprofit, and a little bit like a government agency. And we kind of shift those identities around quite a bit. Next slide. And so if you're going to simplify it as much as possible, what happens is private, federal, and state dollars come to Kentucky Housing Corporation, and then we distribute those across the Commonwealth. Some of our programs are all 120 counties. Some are 118 counties. Some are even a subset of that. It kind of just depends on where the funding is coming from, and if that kind of funding also goes directly to other cities or counties. Next slide. And we have three main areas in which KHC works. And I'm really oversimplifying this, but it's too much to digest the details in one quick zoom. So the three areas are homeownership, rental housing, and what we call specialized housing, which typically has to do with serving people experiencing homelessness. Under homeownership, the biggest dollar amount thing that we do is we finance mortgages for low income and first-time home buyers across all 120 counties. We do this through banks and mortgage brokers, and we often offer down payment assistance alongside our loans. We serve folks whose credit might keep them from getting a traditional loan or an affordable loan that's not predatory. We also do foreclosure prevention, and we will be rolling out this fall a COVID-19 foreclosure prevention program for homeowners, offering them very likely up to $30,000 to get their mortgage caught up, get them caught up on taxes, insurance, HOA fees, and the like. So stay tuned for that. It's not open yet. We also fund home building. So if you have ever worked with the Habitat for Humanity or another housing nonprofit that builds houses or rehabs them, it's very possible they are getting funding through Kentucky Housing Corporation. We also do home repair. Typically, this is for very low income and elderly homeowners who are not going to move from their home, but there might be something going on with the house that makes it almost uninhabitable, a roof issue, heating system's out, it's exposed to the elements. We had a blind gentleman who had a hole in his floor, and he wasn't going to move, so our dollars went to helping him fix that floor. We also do weatherization to bring folks' utility bills down, because that can be the quickest way to get them more housing affordability, is to get that utility bill low. The second big bucket of what we do is rental housing. And so we do ongoing Section 8 administration. We do Section 8 vouchers for 87 counties. And then we do what's called project-based Section 8 contract administration for over 22,000 units across the state. And that's rural areas, urban areas, those are all over. That's a contract that we have with HUD. We also fund the rehab or new construction of apartments all across the state. And that can be anything from a duplex or a fourplex in a rural area to projects that are hundreds and hundreds of units, usually in more urban areas. We do that through tax credits and some lending programs and that kind of stuff. The third area we call specialized housing, and that typically has to do with funding coming through HUD to KHC and then dispersed across the 118 county homelessness continuum of care for the balance of state. Some of you might be familiar with that term. That's something that we serve and kind of staff, the continuum of care. There's an advisory board, and the homelessness providers really are the leaders of that, but we staff it, do an annual application every year, grant agreements, all that good stuff. And through that, we fund emergency shelter, rapid rehousing, meaning just getting people from homelessness right back into being housed as quickly as possible under a housing first model. We have been able to fund some street outreach and eviction prevention with some additional emergency solutions grant funds that came through the CARES Act. So that's like the big picture of KHC. And I'm going to set that aside because none of what I've talked about has to do with the COVID relief programs I'm going to share with you now. So that's just to say we do a whole lot of stuff. And then on top of that, probably like you all, we have gotten new part-time jobs in addition to our regular work, which is to oversee a lot of the COVID relief funds. Next slide. So, and we can go ahead and go to the next slide. So this is a detailed table. You will see it again, so don't worry if you don't digest it all. I'm going to focus on this highlighted column. It's kind of pink or peach, which is the Emergency Rental Assistance 1.0 funding. This was created or allocated through legislation that passed December 27th of 2020. So right at the end of last year, before the Biden administration had even come in and before the American Rescue Plan Act was passed. This provided $264 million to the Commonwealth of Kentucky for emergency rent assistance through Treasury. It's going through Treasury because the federal government wanted it to move quickly, and things don't move quickly through HUD. That's not what HUD's built for. Our program serves 118 counties. And as you can see at the bottom of this table, Louisville and Lexington each got their own direct grants. Almost 21 million to Louisville and just under 10 million to Lexington. We have also taken a portion of our direct dollars and subgranted more money to Louisville and Lexington because we are not serving their two counties. We talk every other week. We are staying really coordinated, but we want them to have enough money to keep going. So we have subgranted 27 million to Louisville and 11.7 million to Lexington. So more than their original grants. I want to underline that. We have more than doubled the amount of funds that they have to work with. Next slide, please. So Healthy at Home Eviction Relief is the state's version of the rental assistance program, HHERF for short. And that website is teamky, hherf.ky.gov. You can also just Google Healthy at Home Eviction Relief, and it'll be the first thing that pops up. We are serving tenants in 118 counties. They have to be in arrears, and they need to be at or below 80% of AMI. We are allowing pretty close to attestation for everyone on income. So we're turning away almost nobody because of income, and we're not requiring that folks upload a ton of documents. In a couple of higher income counties, we do ask for docs, but in most counties we don't, or in most zip codes, let me put it that way. So how we pay is we pay every Friday, and typically it is a lump sum direct deposit straight to the landlord or straight to the utility. If a landlord refuses to participate, we pay the tenant via a direct deposit. That's not our first, this money requires that we first attempt to pay the landlord. So we don't pay tenants directly first. We're not allowed to with this bucket of money. But we do, if a landlord refuses to participate or is unresponsive, we pay the tenant directly. And the assistance can be calculated going back to April of last year. And we will cover 100% of arrears for rent or for utilities or both. And we will cover up to 12 months. They don't have to be consecutive months. It could be they paid some, they didn't pay others, but we will cover basically contract rent times 12. That's the most we will cover for arrears. And then everyone who gets help with arrears, whether it's 1 month or 12, gets 3 future months of rent, 3 future months of utilities. So the max is 15 months. The reason behind this is that's as generous as we're allowed to be. That's what the legislation allows as a max. And we would like to keep people stable into the future. And frankly, we'd like to keep them from reapplying to us over and over every month. We still have a little bit of a backlog, and we want to keep it little. So we don't want folks reapplying every month. The other thing that's useful for you all to know in particular is that we have created the functionality in the application. It's online only, but a third party can help. And they don't have to have a formal official relationship with the tenant. It can be a family member, it can be a church member, it can be their property manager or their landlord. It could be a caseworker. So it can be a formal relationship, but it can also be something as informal as a English-speaking child of a Spanish-speaking head of household. And so the child might do the application and even give their phone number or email. So if we have to contact someone, we know there's a third party that we might contact as part of it. We will still contact the tenant as well. Next slide. So these numbers are slightly dated. We pay every Friday. So I have new numbers as of September 3rd, and I will share those with you. So we launched February 15th and started making payments in March of this year. And so since March and through last Friday, September 3rd, we have paid out $49.2 million, 43.4 million in rent, and 6.2 million in utilities. We have made over 13,500 individual payments on behalf of over 9,300 households. Again, all of this since March of this year with a totally new program. And again, our funding only covers 118 counties. We do not capture the numbers for Louisville and Lexington in our numbers. The average assistance right now is $5,269 per household. We're paying out roughly $2.3 to $3.5 million a week. It kind of depends on, we've had a couple like leaps in productivity when Treasury gives us more flexibility. We have brought on a vendor to try to get faster. And we honestly don't have a gigantic backlog right now. We are probably 2 to 3 weeks away from processing a complete application. And boy, that's a big, like, it's got to be complete. But if we get a complete app, we can pay within 2 weeks. Again, we only pay on Fridays, so I can't commit to 1 week turnaround. But I would say the lion's share, meaning probably 90%, has been paid to directly into the coffers of landlords and utilities. So direct deposit to them. Or some utilities will only accept a paper check. You can imagine across 118 counties, the rural electric, the co-ops, the city, municipal water companies, some of them will only accept a paper check. So it's a mix of everything. It's been really tough to get ramped up fast. And you probably might be aware of the White House and the national press has really come down hard on administrators of this program. I feel like we're a success story. To me, this is a minor bureaucratic miracle that we've gotten this much money out in just 6 months or so, and that we're pretty close to processing in real time. The other upside is we do not expect to run out of funds. We currently have, let me look at my current numbers, almost $154 million remaining to get assistance out to the 118 counties that we serve. We are also considering additional subgrants to Louisville and Lexington if they need it, right? That's why we meet every 2 weeks to figure out how committed they think their dollars are. So next slide. This is just the flyer. This way, if this gets sent out to you all will have the hyperlinks to the English and the Spanish flyers, as well as to the website. And let me pause there on the Healthy at Home Eviction Relief. If anyone, I guess I should look at the chat, or I don't know if you guys open it up to questions. It might make sense to take those now versus at the very, very end.
Sure. So Wendy, we had a couple of questions. One was, is there a particular contact person to ask questions related to eligibility for down payment or mortgage assistance? I have posted KHC's page on eligibility for that and said it will ask if there's a specific contact at KHC or if it's best to start at a local bank since most do KHC loans. So I don't know if you want to handle that.
So this is for loans, not for the mortgage, the assistance. Am I right about, am I understanding?
Correct.
Right?
This is, okay. If I'm understanding the question correctly, it's for prospective home buyers.
Yeah. I would say, gosh, that's a good question. Who would you call? I mean, really, we work through local banks. So I would rather get you all some information later because we're never the first point of contact for a home buyer. It's usually, you know, a bank, a mortgage broker, that kind of stuff. And I bet we've got a list, but I don't have it on me.
I would recommend just reaching out to your local bank and asking if they do KHC loans, because many of them do, and they're very familiar with the process and very helpful. So I would definitely start there, but also check that page for specific eligibility criteria. And then we had a question from Sarah. No, sorry, I skipped over. A question from Rhonda, who wanted to know if there is any funding to assist people with paying off an old eviction.
This is a great question. So in theory, I think that we can. Treasury recently released some FAQs on August 24th, I think it was, saying that we could, at the tenant's request, pay an old arrearage for a unit they're no longer in. We have to figure out what this means. Does it mean they have to have a current application in, or can we just pay their old, if they're eligible, pay their old debt, even if they don't have a current application? I will be honest, because right now we are so focused on keeping folks currently housed, and keeping them from avoiding eviction, we just have not divined how we're going to approach that. It does appear allowable, I'll say that.
Okay, great. It looks like Sarah's question got answered, and then Celine has a question. Now that the CDC moratorium is over, how is KHC managing the time crunch between an eviction filing hearing and attempts to reach a landlord to assess their willingness to engage in the ERA program or get a check in the hands of a landlord? Celine is with the Urban League in Louisville. So in Jefferson County, it can take over 1 to 2 months or more to get a check into the hands of the landlord. And the Kentucky Supreme Court is only allowing for 2 weeks between an initial hearing and a follow-up in order to determine whether or not the landlord will wait 1 to 2 months or more for funds or will move forward with an eviction. So do you want to comment on that?
Yeah, I can tell you what we're doing. So, okay, it's really hard to intervene at the courts at the statewide level, right? We can't currently be in all of the district courts. Like in Louisville and Lexington, they have staff who participate in the eviction dockets. So here's what KHC is doing. First, we, after a lot of painstaking negotiation, brokered a data sharing agreement with the Administrative Office of the Courts so that we are getting eviction forcible detainer filings data every day integrated into our application system. It took a minor mountains being moved to make that happen. So we get that data every day and it flags our current apps that need to be prioritized so that we assign those out first because we know they've got a case filed against them. What we've also done is if we get that case data, that serves as proxy documentation and collapses how much we have to get from the tenant. So we don't need a lease. We don't need a late rent letter. It collapses how much, it's a lot easier. We basically need an ID from the tenant and an attestation from the tenant. We need a little more from the landlord, but it makes it so we prioritize them via the data. We assign them out first. We reduce how much documentation they have to get to us, and we prioritize those. The other thing we do is that if we get the data in, but they don't currently have an application, we create a dummy app, if you will, or a placeholder app, so that, and we are right now about to try to hire some more staff to try to reach out to the landlord or the tenant, although we don't get a phone number with the AOC data. So we have to go through like all the online subscriptions where you try to find somebody's phone number so that we can try to reach out to them. And if the landlord will participate, then we could get them money to prevent the eviction. If the landlord won't participate, then we can send the tenant direct assistance so that they could use the dollars to pay their arrears, get rehoused. We are also we're piloting, and we've been doing this for a couple of weeks now, we're doing a snail mail of just flyers with application instructions to landlords and tenants and attorneys when we get that daily import of data. That's not perfect, but we hope that helps us between prioritization and collapsing the documentation. We've also brought on a vendor to help us process files. They don't make any payments, we do that, but just to add to our capacity in hopes that, our hope was we would be processing real time when the eviction moratorium ended in October, early October. We didn't get that wiggle room, but we're pretty close. So that's how we're approaching it. We are aiming to pilot being in a couple courtrooms, and we're looking at the data that's coming into us to try to decide where is it most important for us to place staff in the courtrooms on eviction docket days.
Great. Angela wanted to know, is there an idea when a definite answer application would be available on the past eviction question from earlier?
I would like to be able to answer you. I'm sorry, I don't. I mean, our hair is on fire and I just don't know. So I'm not saying that that's not important. I'm just saying right now we are, because what we have to do is revise our program design. Right now you have to be in arrears. And so does an old one, maybe that counts as being in arrears. So we've got to like think it through and map it out and then figure out how do we get the app in, how do we document it, all that kind of stuff. I don't have an answer for you, I'm sorry.
Okay. And then we had another question from Terry, if utility arrearages, which might fall in the same category, could be paid once the tenant has moved.
I believe that they can, but again, it has to be at the tenant's request. Right, we have plenty of landlords mad at us because we won't pay if the tenant has been evicted or if the tenant self-evicts. But the Treasury FAQs make it clear the tenant has to request it. I believe that applies to utilities as well. I'd have to go back and read those recent FAQs to make sure, but I'm pretty sure. I would love the phone numbers to be added to the AOC data. I just saw that come through on the chat.
Yes.
Oh my God, it would make such a big difference. We've asked for it, but it's, yeah.
I think it's an inside-outside approach. We as advocates will work on this as well, because I agree. It's low-hanging fruit. It's easily done.
I know Louisville advocates have asked for it.
Yeah.
I know that.
Yeah. Okay. All right. Well, with that, I think we've answered all the questions. If not, you can yell at me in the chat and we'll let Wendy go on with her presentation.
Great. So I'm now going to move on to dollars that were passed under the American Rescue Plan Act, which just passed March 11th. These are funds, let me scan them. We are only using one bucket of these funds currently. The rest are kind of in plans underway. And so there's 4 buckets of funding related to housing that's coming under the ARPA legislation. That's a second bucket of emergency rental assistance, $209 million to the state, and again, direct grants to Louisville and Lexington. The homeowner assistance fund, I touched on that. That's to help homeowners who were affected during the pandemic get caught up on their loan, taxes, insurance, that kind of stuff. There's also this giant bucket of funding we already get called the Home Program, but it's a new allocation targeted only at creating permanent housing for the homeless or non-congregate shelters. And then we got a bucket of additional emergency housing vouchers. These are Section 8 vouchers. They don't last forever, but they last for a couple years. And we got 257 of those. We have begun taking referrals in pursuit of leasing those up. So that's underway. The others are kind of in planning states. Next slide, please. And we can go ahead and go to the next slide. I kind of already covered this. So the Emergency Rental Assistance Program 2.0, very similar to what we're doing, the funds we're using for Healthy at Home eviction relief. There are a few differences. It's slightly less money, but it's still more than we ever say grace over. And we've never done emergency rent assistance until we started last fall. And again, it will cover rent, utilities, and housing stability costs. There are some flexibilities beyond ERA1 that make it even more useful. And 10% of these funds can go toward housing stability services. There's an 18-month max on these dollars. And again, it's the same eligibility. They've got to be an at-risk renter, and they've got to be at or below 80% AMI. Next slide, please. So the potential uses that we are looking at for ERA2, we would like to keep the Healthy at Home eviction relief program and our eviction diversion work within that going through September 2025, so for many years. We would like to supplement Louisville and Lexington's programs because the formula for this, just like with ERA1, kind of underfunds them. So we would look at keeping that additional funding going to them. And then we are looking at funding housing stability services like eviction diversion, tenant legal services, and funding some of our homelessness organizations to do prevention, housing navigation, rehousing, that kind of stuff. And the theory behind funding our homeless partners is through the CARES Act, they've got this giant increase, over 900% increase in funding from emergency solutions grants. And that is going to sunset in 22, next year at the end of August. And so we would like to keep they've expanded their geographies. Many of them have expanded staff, or would if they knew the dollars were going to last longer. So one of the things we'd like to aim to do is to use ERA2 to keep the eligible activities that they began under ESG going with the ERA money. So if you look under item 4, we would like to fund homelessness prevention and rehousing. So that's paying the arrears, future rent and utilities, security and utility deposits. We can also pay for hotel motel stays, like to get someone immediately housed while they're searching for a permanent unit. And then we could also look at using the funds, and we have had several conversations with Eric Friedlander at the Cabinet for Health and Family Services and some of his commissioners, the commissioners related to Medicaid, as well as DCBS, about using some of the ERA2 dollars to pair with Medicaid services or other service dollars to then offer rent support for up to 18 months for populations like youth aging out of foster care, people exiting substance abuse recovery, the Olmsted severe mental illness population, those exiting DV shelters or reentry after incarceration. We don't have enough money to house all of these groups. These are just examples of where we might tack some of the ERA 2 to special populations where there might be service dollars from somewhere else, and then we could provide the housing support. Next slide, please. The Homeowner Assistance Fund, I mentioned that to you all. This is only coming to KHC, not to Louisville and Lexington. This is $85 million to help homeowners who got behind on their mortgage during the pandemic. We've actually recently received some guidance from Treasury, so we have finalized and submitted our plan. That's a little bit of a dated bullet. However, there's not an immediate threat of people being set out on the street who are homeowners. There's a threat, but it just doesn't move as quickly as evictions for tenants go. Foreclosure takes more time, and there have been a lot of forbearance tools brought to the homeowner landscape that just aren't available for renters. We do have a sign up, this is the link to it in here, where you all or homeowners, bankers, whoever, realtors could sign up so that they will get notified when our program opens or when we release the guidelines. So we'll keep people up to date through that. And it's just a sign up, it's a MailChimp sign up, and you get emails from us. Next slide, please. We got these Section 8 emergency housing vouchers from HUD. Again, we actually got 270 some because one local PHA decided not to take theirs, but we got a nice chunk. To give you a comparison, we oversee about 4,700 vouchers normally. So this is adding to that. And they are targeted to helping folks who are at risk of or are experiencing homelessness. This has to be a partnership with our homelessness continuum of care where the COC makes the referral to the Public Housing Authority. And in this case, I know it's confusing, KHC is both. We are a public housing authority for 87 counties in Kentucky. We are also the administrator of the continuum of care for 118 counties. So this involved us doing an MOA with ourselves, funny as it was. But there are also other public housing authorities across Kentucky that got these EHVs. And I believe that's on the next slide. Yeah, so you can see Louisville and Lexington got hefty additions with these vouchers. A bunch of housing authorities got small ones. And then KHC, and I have the number correct here, we got 272. And all of the ones that are highlighted in pinkish peach are the ones that would work with our continuum of care administered by KHC to get referrals for people experiencing homelessness or at risk into their vouchers. So the state overall got 582 of these new vouchers. Next slide, please. Okay, the HUD Home for Homelessness. Again, this is a program we usually get about 12 to 13 million every year in home dollars, and it can be used for lots of stuff. This is a unique allocation of 71 million, not $71, from HUD across Kentucky, and we'll show you, well, it might be on another table, but this is not just a KHC. Louisville, Lexington, Owensboro, and Northern Kentucky are also getting allocations of these dollars. It's an unprecedented earmarking to serve the homeless. And home dollars are pretty much never earmarked. They've never been earmarked for the homeless population. And we can use these dollars, we could do rent assistance, but the bigger aim is to develop either permanent housing for the homeless or non-congregate shelter. What does that mean? Non-congregate shelter means it's emergency shelter. It's not permanent housing, but it is not in one large space. So you could think hotel motel conversions. We are in theory going to be able to use some of the dollars to support services, but that is murky and has never been done with these kind of funds before. So we are awaiting a bunch of information from HUD on this. They've released Zilcho to give us a sense of what we can do with the dollars and what the rules will be. And so we have engaged KHC, the Corporation for Supportive Housing, and did a kickoff meeting last week with them to start thinking about how would we design the program? How will we allocate the funds? How will we make sure? My biggest worry is not how do we get them built, but how do we make sure they are able to offer financially feasible housing and services over time to the folks who live in the units that are created. Next slide, please. Oh, and that's it. So if you know, a lot of this is to be determined, right? So KHC egrams are probably your best way to just know what's going on or hear about a funding round or any kind of an announcement. So I encourage you all to sign up if that seems relevant for the work you do. And then I think the last slide is just my contact information. Oh no, I forgot, I put in here a little bit of information about the state and local fiscal recovery funds. It's not housing specific. These are very flexible and can be used for lots of stuff. They can be used for COVID testing, assisting schools, PAVES, first responders. But I just wanted to give you a sense of there's a lot of this slightly more flexible money out there. Like I know Louisville Metro has used a tiny sliver of theirs to offer right to counsel legal services for tenants. So it can be used for many kinds of things, including housing, developing housing or services. But you know, cities, counties, and the state are all thinking through how they're going to allocate these funds. Next slide. Maybe that's the last one. Yes, that's the last one. I'm guessing more questions have come in.
Well, we actually, we liked number 5 under the home for homelessness, housing for special populations. And then Bev from Louisville says, we have heard Louisville and Lexington are carve outs in many areas. Is there opportunity for those areas? If so, contacts. So who would you recommend Bev reach out to? I know that she's in Louisville, but she also works with folks across the state.
Sure. So if whoever's driving the PowerPoint will go back to my table where it has like all the stuff on it. Keep going. There you go. That's great. That's great. So for emergency rental assistance 1 and 2.0, the grantees are the urban counties themselves, right? So the urban county government staff is who you would contact about ERA 1 or 2. Some of them have, I know they are each also using their local community action agency as the entity that takes a lot of applications and deploys funds. So either the government or the local community action agency for Louisville and Lexington. Homeowner assistance, that's just KHC, no sub-grantees for that. For the home dollars, that also is going to be the local government. So Louisville and Lexington, the urban county government. In Northern Kentucky, Covington is the administrator of their Covington Consortium for Home Funds. And then Owensboro, it's the city of Owensboro. And then in terms of, if you don't mind going down a couple more to the table of the public housing authorities. There you go. So, and then in this case, this is harder to answer, right? The housing authority is the administrator of the voucher, but the continuum of care for homelessness is the entity that is supposed to make the referral to the public housing authority for these vouchers, meaning that the continuum of care is saying this person is homeless or is at risk of homelessness and meets like our prioritization for these vouchers, and we are recommending them, we are referring them for the voucher. I can say for KHC, what we are trying to focus on, but man, it's harder than it ought to be, is we are trying to identify folks who are receiving a short-term housing assistance, like rapid rehousing or something, and identifying them to swap out their shorter-term assistance with a emergency housing voucher. And then over time, as the expiration of these vouchers approaches, we are moving folks onto our waiting list so that they would get a regular voucher and never lose their, and hopefully never lose their voucher, because these do expire in 2023, if I remember right. anyway, that's a very complicated way to say it depends.
Okay. Questions? Can you talk about KHC services or KHC funded services in the Christian County area? That would be Hopkinsville.
Right. You're going to want to contact me via email because I'm not the person. I mean, we do so many different things that I would need to understand. Like, I don't think we do vouchers there, but it just depends on county by county. We have a different profile of what programs are active in that county. And I don't know what part. I'm kind of removed from the day-to-day. So I would need to get you in contact with staff.
And I am happy to post, we have kind of put together a profile of county by county assistant, so I will post that in the chat to Marcia. Greg Knight wanted to know what the MailChimp address was. That is to be notified for the homeowner assistance fund.
I'll paste it in the chat here.
Okay, cool. Because I thought I had it up, but evidently I don't. It's not one of my 15 tabs.
It's in the chat now.
Cool. All right. Any other questions for Wendy at this point? Oh, we do. Yes. Sheila would like to know what kind of services do you offer for folks with severe mental illness? And Rhonda, yes, I will post the link to our county by county contacts.
So let me, I want to be really clear. We don't usually do any services. We usually just fund partners to do it, right? So I just want to make sure that's clear. And probably whoever asked that understands that. But for SMI, we work with the Cabinet for Health and Family Services on an Olmsted housing initiative. Now it's very modest. I think we house around 120 households, usually individuals, who have exited a more, what's it called? It's not it's more of an institutional setting. It's not a group home. I can't remember, adult care home, something like that, who are then trying to live independently. All we do is run the housing assistance. We pay the landlord every month. We do the lease. We inspect the units periodically to make sure they're safe and okay. And so we kind of run it like a Section 8 program almost under a contract that we have with the cabinet.
Okay. Yeah, that helps. Thank you very much.
Mm-hmm.
Okay, any other questions for Wendy? All right, well, with that, we'll turn it over to Kelly. Sorry.
No apologies necessary. And I'm looking at the clock. We might actually be able to bring it on home a little earlier than usual today. For folks who are new with us today, these following slides, many of them are repeat materials. We do try to update them with the most up-to-date information, but it's links, resources, letters, petitions, applications, things that we feel would be helpful in the work you do personally and professionally to help the communities you serve. So the first set here, a few months ago, ThriveKY partnered with the Cabinet for Health and Family Services to create a landing space for the American Rescue Plan Act and the variety of ways it helps Kentuckians. We chose 6 buckets. It is certainly not comprehensive to the full scope of what ARPA does for everyone, but the 6 buckets we chose that we felt were more kind of direct individual assistance and support included stimulus checks, child tax credits, the premium subsidies during the special enrollment period and continued healthcare.gov saving opportunities, the SNAP food assistance that Jessica covered a little earlier and spoke to in respect to the emergency allotments and increases that we are able to have, pandemic EBT for school meals at home that was created last year for our children, so they do not have to worry about whether or not they are in school so that they can still eat, as well as housing relief. And again, these are not the full benefits of what ARPA does for everyone, but these are the buckets that we feel can be most useful in just like community-based services and what we all do. And as of last week, for anyone who's not visited, let me type it in here, the tiny URL. It just got updated recently. Our FAQ is a little more up to date than what it was in April and May when ARPA first kind of came to our doorstep. The next couple of slides here include links for rental assistance, homeless assistance, utility assistance, and some other resources that, again, we just feel if you just kind of keep on your desktop or plaster it on the wall, they kind of come in handy, as does our legal aid resources, which for many Kentuckians is often their first step in the door to really get some legal support, whether they are facing evictions or some other circumstance. The next two slides here, and Dr. Schuster and Marcy, I don't want to put you on the spot, but it is Suicide Prevention Awareness Month.
Right.
We have the slides here with the hotlines. Do either of you all want to put a quick plug in here?
Yeah, Marcy Timmerman from Mental Health America of Kentucky posted these. We know that the pandemic, the COVID pandemic, and also the racial tension and racial trauma has significantly contributed to the mental health issues that people have been feeling. So we really, really encourage you all to reach out to people that might be struggling and have them call, get in touch with a live person. We've posted here all kinds of suicide prevention. The Trevor lines are for LGBTQ and questioning youth to reach out to a like-minded person who can just listen. And there's also a text. We know that some of our youth and young adults would prefer to text rather than to call. So there is no stigma attached to it. You will get a call answered by someone here in Kentucky. That's why they ask for your location so that they can get you to a suicide prevention counselor that's close by. So we really, really encourage you to reach out. We want to keep the suicides, successful suicides, to zero in this suicide prevention month. So again, no stigma attached. We're all suffering, and it's good to reach out and talk to somebody that can help. Thank you, Kelly.
Sure, and that is something, of course, we battle cry all year long. The next couple of slides here, these are some useful links for a variety of food assistance programs available to Kentuckians now. If you are like any of us and geek out over some data, the good people of Kentucky Center for Economic Policy continue to maintain a few trackers here. If you'd like to kind of do a deep dive on any of the safety net supports actively ongoing in Kentucky and kind of see where the dollars and cents actually occur. Our story banking project, many of you are probably very familiar with the promotions that the Homeless and Housing Coalition of Kentucky, as well as Kentucky Voices for Health, promote. Katie Mueller is jointly pursuing stories, whether it's healthcare, houselessness, a combination of both, and they can be good, bad, everything in between experiences that we'd like to elevate as a way to build the picture that policymakers need to see and hear. And that can be something that's video recorded, written recorded, however we can reach each other. We've got a few save the dates here for upcoming Thrive webinars, as well as our next quarterly format with the cabinet in November. And we leave the Advocacy 101 training with Dr. Schuster on here. This is from last summer, but since we are day one into a very, very special session. It is probably more timely than ever to kind of refresh our brains and beans on Advocacy 101. For any licensed social worker or certified community health worker in the room, please email me. You can do this one-off, or if you'd like to simply reply to the email I send to everyone tomorrow, we'll be sure to get you some continuing education credit for attending today. I try to get those returned to folks as quickly as possible, but given the week, it might take me a day or two, but I will work with you on whatever you need personally. Thank you again to our 2021 sponsors. They allow us to provide these formats to you for free. They allow us to offer those continuing education credits to our social workers and CHWs for free, and we appreciate their ongoing support. And the last slide here, for anyone who presented today or that you would like to reach out to personally within the Thrive Kentucky Coalition, the last slide in the slide deck will include a lot of our contact information, and we encourage you to never hesitate. We all do better when we all do better, and we're all in it together. And so unless there are any outstanding questions, I am prepared to give you all 12 minutes of your time back.
Kelly, I'd just like to thank Adrian for pulling together an excellent program, and so many thanks to Wendy Smith over at Kentucky Housing Corporation. I think this has been an excellent presentation on housing. Wendy, we appreciate your expertise and your willingness to spend your time with us. And I'm sure we will be in touch because there are many housing issues that we're all concerned about. So thank you again very much.
Thanks,
and you all have a great day. Remember to raise your voices with your legislators if there's something going on in the special session that you don't like. Let them know.
All right.
Thank you all.
Yeah.
It's been a pleasure.
Thank you. You all have a good day.